Your Social Security increase for 2026 is not 2.8%. It's actually 1.9% for most people. And for some, it is actually a 1% increase for 2026. That is according to the New York Times, which posted a bombshell article this morning talking about the Social Security increase for 2026 and analyzing and realizing that rather than people receiving 2.8% increase, the actual increase is 1.9%. And for people receiving $1,000 or less in Social Security benefits, your Social Security increase is actually 1% when you factor in everything else. I want to talk about this and help you understand what's happening here. Plus, President Trump gave an update on his $2,000 stimulus check. He wants to send the stimulus sometime next year, and included in that package are seniors on Social Security and disability benefits. However, there are people that are skeptical about whether this $2,000 stimulus is actually real. And so I am going to give you four reasons why there is doubt about the stimulus. And I'm going to give you one reason why I believe that seniors are going to get that stimulus next year. My name is Kwame Kwade. I am a government benefits expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance topics that affect seniors and their retirement and their benefits. So, if you are new to my channel, welcome. I am glad you're here. Do me a quick favor, go into the comment section and let me know your city and your state. Now, if you've been watching this channel for a while now, welcome back. I am glad you're here. Thank you for your continuous support. So, I have a lot to cover with you. I am going to start with the New York Times and what they claim to be the reason why they feel that your Social Security increase for 2026, it's not 2.8%, essentially saying the government is lying to you and that your real increase is 1.9%. And for most people, it's 1%. So let's read the article together. I'll pull it up and then we can dig into it. So let me take this off the screen and then go to the New York Times and then we can read that together. So the main article was talking about the fact that Medicare Part B premiums have increased substantially. So it says what to know about the nearly 10% climb in key Medicare expense for 2026. The rapidly rising premium for Part B, which covers retirees' outpatient services, reflects the fast pace of growth for healthcare costs nationally. So according to the New York Times and crunching the numbers, here's what they found. If you are enrolled in Medicare, you know that the cost has been hitting your wallet harder lately. That is probably the understatement of the year. But the program's rapidly rising premiums and out of pocket charges come into sharp relief last week, came into sharp relief last week when Medicare officials announced that the standard Part B premium, which covers services such as physician visits and hospital outpatient care, will be $202.90 a month, up 9.7%, which is almost 10% increase. Next year is the first time the monthly premium will exceed $200. So this is important. For the first time ever, your Medicare Part B premium is going to be more than $200. That's never happened. So that is an important thing for you to bear in mind as I walk through this. And then they go on to say this, and it will be 66% higher than a decade ago. Now, we all expect that cost will go up, right? We expect that costs will go up because of inflation every year, but we don't expect to see a 66% increase in medical care in Medicare Part B premium over a 10-year period. Why is that significant and why should you be concerned? Well, I am going to show you how much your Social Security benefits went up at the same time. So, over the last 10 years, Medicare Part B premiums, if you add up all the increases, have gone up by 66%. Yet, here is your Social Security cost of living adjustment for the last 10 years. If you add them up from 2016 to 2025, you are going to get 31.1%. So your Social Security benefits have gone up by half the amount that your Medicare Part B premium has gone up. So if you're a senior citizen and you feel like you can never get ahead, and that every time you get your Social Security benefits, it gets eaten up by Medicare Part B premium, among other things, now you have evidence. You have two pieces of data that is telling you that you are right. What you're feeling is true. Number one, that cumulatively over the last 10 years, Medicare has gone up by 66%, Part B premium. Plus, your Social Security cost of living adjustment over the last 10 years has only gone up by 31.1%, less than half of the 66%. You're not even getting half an increase. So, what does that mean? It means that your medical care, and this is just Medicare Part B premium, we are not talking about all the other costs that seniors have to face when it comes to Medicare. Out of pocket costs, maximum out of pocket costs, deductible, co pays, co insurance, all these things that add up, and why the average senior is spending about $6,600 a year in out of pocket costs. And if your Social Security check is not catching up, then it makes sense that you always feel like you are always falling behind. So let me share a little bit of what the New York Times is saying, and I'm going to share with you a CNBC article that is talking about the breakdown of the actual cost increases that are coming next year. But before I do that, if you want to stay up to date on all this news, breaking news updates that we've been getting consistently, almost daily, in the last year, then text the word insider to 443-293-0080. You will be added to my text list. You will join thousands of seniors and others that are receiving one or two text messages from me each week, alerting you about breaking news and updates, things that are going to affect your benefits, your retirement, and your finances. So if you want to stay on top of all this and not miss anything, text the word insider and join my text list. It's free of charge. You join the list and you start receiving timely updates. Text insider to 443-293-0080. Now let's read a little bit more of that New York Times article, because there are certain sections that I want to show to you. In addition, the annual Part B deductible will also climb to $283, up 70% over the past 10 years. So here's another data point that I'm giving you. Number one, Medicare Part B premiums have increased 66% over the last decade. Now, Medicare Part B deductibles have shot up by 70% over the last decade. And I'm sure when you go to other areas of Medicare, you're going to find similar increases. And Part B is just one component of senior health spending, but it's closely watched number for many because typically it is deducted from your Social Security check. So the New York Times is saying that the net annual cost of living or COLA increase in Social Security depends on the dollar amount of the Medicare Part B increase, because what they're saying is that, look, the government can tell you that they're giving you a 2.8% Social Security increase, but what are you going to get in your check? The money that hits your bank account, it's also has to take into account your Medicare Part B premium. And if the Medicare Part B premium is eating up your check, the net amount you get, the government say you're going to get an increase of $56, but that's not what happens, because Medicare Part B increase is going to take a portion of that. And so that's how they're arriving at how much your real increase is going to be. And so they're saying that next year, the Part B rise will consume a substantial portion of the 2.8% COLA announced last month. The average retired worker received $2,008 per month. The premium increase is $17.90, will reduce the worker's effective COLA to 1.9%. That is right there in plain sight. So you can see it right here. And then it gets worse. For lower income beneficiaries receiving $1,000 per month, the effective COLA is 1% increase. That is why many people are struggling. Many people will not receive the COLA they might anticipate because the premium eats part of it, said Tricia Newman, Senior Vice President at KFF, a healthcare research nonprofit. So, why the big jump? There's a lot of reasons why Medicare prices are jumping, but the main point is that your Medicare prices are going up substantially, and your Social Security cost of living is not catching up, and that is the main problem that we face right now. Now, I'm going to go to the CNBC article and analyze what the cost increases are specifically, so that you can see for yourself what is coming up, and the government is getting ready to mail you letters telling you what your increases are. So here's what CNBC says: will soon Social Security beneficiaries will soon receive a 2026 benefit notice. Here's the changes you should expect. So starting in December, they are going to mail you a notice telling you how much increase you're going to get, right? But what is in there is the increases. So about 75 million Americans will see a 2.8% cost of living adjustment to their Social Security. The increase is expected to add $56, but as I have explained, that $56, about $20 of it is already going to go to Medicare Part B premium. So, one thing the notice is going to tell you is a tax deduction. Remember, in the big, beautiful bill that I shared with you a couple of months ago, includes a $6,000 tax deduction that a lot of seniors thought would apply to them, but it only applied to people who are making enough money to have taxable income. So, if you don't have taxable income and you're receiving Social Security or disability benefits and you don't pay taxes, this 6,000 bonus deduction that President Trump included in the big beautiful bill does not apply to you. But nonetheless, if you are paying taxes on your Social Security, then you may be able to take advantage of it. So it says most retirees won't notice the change until tax filing season because the $6,000 is provided through a deduction. Those eligible won't necessarily see that 6,000 in their refunds. So it won't be a dollar for dollar savings like a credit will be. So there's a distinction between a tax deduction and a tax credit. So what data should you be expecting in that letter the Social Security Administration is going to send? Well, the first thing is that the average retiree is going to get an increase and their check is going to be 2,071. That is the average. If you're on disability benefits, your average benefit is 1,630. If you're on SSI, the maximum benefit is 994. If you're a couple on SSI, the maximum benefit is $1,491. Moving on, let's talk about Medicare Part B. I already talked that it's going to jump to 10%, but here are the actual costs. If you make less than 109,000 and you're single, you're going to pay $202.90. And if you're married and you make less than 218,000 as a couple, you're going to pay $202.90. And then it begins to increase after that, the premium that you pay, and that is what is called the income related adjustment amount, IRMAA, income related adjustment amount. And that is what the Medicare services uses 2 years of your previous year's taxes to then figure out your income, and then they determine how much you should be paying in Medicare premium based on how much money you make in total. So it goes all the way from $202.90 for the lowest beneficiary in terms of payment to $689.90. Finally, what the CNBC article is talking about is something I've been talking about for a long time and continue to bring home, which is that Medicare enrollment, open enrollment is right now. And as a senior, the worst thing you can do for yourself this year is to automatically renew your Medicare benefit without talking to our partner, Chapter Medicare. Now, why should you be talking to Chapter? Why is it important to have your Medicare reviewed before you agree to renew your benefit? Well, here's the thing. Even though you have earned your Medicare benefit, even though you've paid into the program 40 to 50 years, and sometimes even more, a lot of seniors are not getting the best out of Medicare because they are in the wrong plan. 90% of seniors are in the wrong Medicare plan. There are 24,000 plans out there. Sometimes it's very hard to choose from. And here's the thing: you may think that you're on original Medicare, and that does not apply to you. But here is the thing: if you're on original Medicare, you probably have a Medigap plan. Well, there are changes that are happening with Medigap. Medigap Plan F is being phased out in most places. So Plan G is the most popular plan. Number two, if you live in one of 6 states, going forward starting January 1st, 2026, you are going to need pre authorization to access certain services, procedures, and devices. And so to just renew your even original Medicare plan just automatically like that without considering what changes are happening with your Medicare plan, it's a big mistake. And if you're on an Advantage plan, it's even more important because a lot of plans are leaving specific states altogether. Some hospitals are dropping Advantage plans, and prescription coverage is changing. So, my job is to educate you about all of this and connect you to the best resources that can help you figure this out so that you don't, now that I'm talking about cost increases in Medicare, so that you can save money and minimize your costs. There's so much going on in the news regarding Medicare that can be scary, but if you have the right advisor in your corner, then you can avoid surprises down the road. So, what do I want to talk about today? Well, I want to share testimonials from people like you. Over close to 4,000 seniors have called our partner, Chapter Medicare, and have gotten that peace of mind that I'm talking about. And to have peace of mind next year about Medicare means that you've done two things. Number one, you have reviewed your current plan during the annual notice. They sent you that letter in the mail. You've reviewed all the changes that are happening, and you understand what is changing with your current plan. And then number two, you have compared that plan to all available plans that are available to you that you are eligible for in your local area, in your state, and have determined that either the plan you're on is the best plan for you or you need to switch to a better plan. That is what I call peace of mind. And Chapter can help you do that. They are open this weekend, and during the open enrollment, they're open during the weekend. So call 539-205-2147. They're open during the week also. Sometimes it's easier to get through during the weekend. But if you call and the line is busy, try again because it's a busy time. But this is a call you don't want to avoid. 539-205-2147. If you want them to call you, go to axchapter.org/insider. That information will be in the comments and in the description to this video. But why should you call Chapter? Well, they offer free and unbiased opinion. And whenever I say unbiased, a lot of people are suspicious of that. So don't listen to me. Don't take my word for it. Let's listen to seniors that have called Chapter and what they are saying. So this is one. I'm listening to your channel from Stockton, California. I want to thank you for recommending that we call Chapter during this open enrollment period. I called them and they have helped me choose a better plan. So now I am set for the new year. Thanks again. You can see that I liked that comment. Again, thank you very much for sharing the Chapter information. I called over the weekend and was able to register for a different Medicare Advantage plan that had all of my doctors and covered my medications. Here's another one. Thank you for your help. I called Chapter Wednesday. Yesterday, I was called back with great information, and Tim Chambers helped me perfectly. And then I responded to the person because I was excited to hear, and he's actually providing names so that you know that this is real, right? And then here's another one. I called Chapter, and the young man was so helpful and gave me the best advice. I am thankful that there are unbiased people to help seniors. See? And then I responded to that comment because when I tell you they are unbiased, a lot of people don't think that that could be true. It actually is. Their main job is to help you get into a better plan and so forth and so on. Here's somebody that found out that they're already in the best plan. I just reviewed my Medicare through Chapter and they told me I was in the best one for me already. That is awesome. And that is what I call peace of mind because now you have an independent, unbiased opinion tell you that you're in the best plan already. What is better than that? Then you can sleep knowing that you have a plan that meets your needs and can serve you well and help you when you're in need. These are the people you're going to be talking to when you call Chapter. I pulled all of this from their website. great people that are ready to help you. So give them a call, 539-205-2147. They are A plus rated with the Better Business Bureau, 5-star reviews like I've been sharing with you, and you are not going to regret that call. So give Chapter a call today. I'm going to put their number on the screen also as I close out. So guys, not only can they help you, they can save you $1,100 on average. So that's what I wanted to discuss with you today. Let me know in the comment section what you think about all that I shared today. If you have any questions, hit me up in the comments. If you like what you heard, hit the like button, hit the subscribe button, and I'm looking forward to seeing you in another video tomorrow.